5G Verticals Innovation Infrastructure, or 5G VINI, is a European Union-backed venture that brings together 23 partners, including CSPs, technology vendors and researchers. I'm Guy Daniels, Director of Content for Telecom TV, and in this series we are hearing from different stakeholders in 5G VINI. Now, the 5G VINI project is proving that it's possible to simplify network slicing with zero-touch digital orchestration that is building the foundation for reliable, profitable 5G services for verticals. Our previous programme introduced the 5G VINI project, its achievements so far, and what it takes for a CSP to enable 5G use cases at scale. Today, though, we are going to hear from Oslo University Hospital on how it is developing health use case examples and the lessons it's learned. And we'll also hear from Nokia on the importance of orchestration, automated network slicing, and experiences from other projects. And there'll be an opportunity for you to ask questions of all our guests during our live Q&A programme on Tuesday, the 5th of October. So please send in your questions as soon as you can. Joining me on the programme today are Deepa Ramachandran, Director Product Management, Digital Operations at Nokia, and Ilanko Balasingham, Professor of Medical Signal Processing and Communications, the Intervention Centre at Oslo University Hospital in Norway. Welcome both of you. Thanks for joining us on our discussion today. Now, Deepa, networks are transforming. We're moving from 4G to 5G, and their capabilities are increasing, as are the demands from users, especially in vertical sectors. It's becoming more than just about providing basic connectivity.
Oh, absolutely true. I think it's very clear that CSPs are now looking at what can they do beyond connectivity. So not just carry the voice and data as they were before, but unlock the value of their networks. So they are looking at how to create a digital value creation platform, so to say, transform as digital service providers. And as we all know, Guy, we are moving to a new normal, different ways of working from home as I'm today, satellite corporate offices, virtualized access. So everything is changing. Private networks are highly preferred by enterprises because they provide the way for them to customize as per their need, provide them the security that they need. And then we have the diverse set of Industry 4.0 use cases to talk about. So industrial plant automation, operating in extreme environments, and then medical equipment, which have very high degrees of precision and automation to operate. So all this means that these use cases are driving specific characteristics or capabilities out of the network to operate in real time. So definitely, CSPs are undergoing a major change in the way they look at themselves.
Thanks, Deepa. Well, let's look at some of this innovation that you mentioned in more detail. Ilanko, you've been working on a number of 5G VINI healthcare use cases at Oslo University Hospital via the 5G Heart project. Can you talk us through some of this work and explain what value 5G brings?
So let me tell you a little bit about the use cases. We have working on with 3 use cases. One is a pill cam. So this is a tiny little pill having a camera inside and with a wireless unit and transmitting data to a recorder belt. And then from the recorder belt, the video will be transmitted through a 5G network to a cloud to do automatic data analysis. So the way that pill works is that the patient takes the pill, hopefully at home, so they don't have to come to the hospital. And then the pill will be traveling inside the gastrointestinal tract. And this will take something like 10 to 12 hours. And then the pill will be transmitting data to a cloud, where the cloud will be doing the data analysis to detect something called polyps. So these are like early phase of cancer, potentially can grow into cancer. So we are very much interested to see whether these patients actually have these polyps as early as possible so that we can rescue them. The second application that we are working on is remote ultrasound examination using a robot. So this means that the ultrasound probe, which is going to be used in a remote clinic, potentially they don't have an expert there and need help from an expert located in a different place or a centralized place. And this expert will be providing, using a remote joystick to control the ultrasound probe to do the examination remotely and looking at the images, both the video images of the patient as well as also the ultrasound images, and providing feedback to the patient and the physician at the location. So this is the second use case. This third use case is about using 5G network connected to an ambulance in Oslo, and where the paramedics will be using video cameras as well as sensors, potentially using like ECG sensors, and will be deployed, for example, in an acute situation, and will be transmitting high definition video data along with sensor data to a center where they will be given instruction about what to do next when it comes to this patient. So these are the three applications that we are working on in Oslo.
Oh, that's absolutely fascinating. And in running these use cases, what challenges did you face and what lessons have you learned so far?
So in a hospital setting, we have a dedicated network internally. And when we want to use a public network like, the 5G network, it's going to create a problem when it comes to connectivity with the internal infrastructure with the public network. And the hospitals, at least in Norway, they are not having this possibility today where we could exchange patient-specific information like data or video that we could identify the patient. And currently that is not possible. So this is going to be a challenge in the future, how the regulations are going to be to use this type of fantastic network like 5G network.
And Deepa, how is Nokia assisting here, and how are you helping within the 5G Vini project to overcome some of those challenges that Ilanko mentioned?
Oh, Nokia has been quite happy to collaborate on this Vini project because we are now exposed to use cases which are real world examples. So for example, if we just talk about the two scenarios that Ilanko had mentioned, one related to the pill camera, where he's doing remote monitoring and analytics, it means that the network has to ensure that the latency is within control so that the applications which are processing on the data are able to meet their demands. Or in the case of the remote ultrasound, it's a combination of a EMBB slice and an ultra reliable low latency slice, which means throughput and latency have to be guaranteed. So that's where the Nokia solution for the end-to-end service management and orchestration and assurance called the Nokia Digital Operations Center comes into the scene. So we have the ability to create the 5G slice, design the slice based on the use case, deploy the slice, monitor the slice for its performance, and then take assurance actions if any of these SLAs, whether it's throughput or bandwidth or latency or whatever is needed, is always kept under check, and then decommission the slice when it's not required. And all this is enabled also with a unified inventory, which has a holistic view of the service, the network, and the resources which are associated to the slice. So that at any point of time, the right assurance actions can be taken so that the quality of service is always maintained. So that's how Nokia is collaborating on this work.
Thank you, Deepa. And Ilanko, what do you think has been the value of 5G Vini, and what are you already gaining from the work that you're doing?
So the value is basically to understand the new features that 5G is providing, for example, compared to 4G network that we already have here. So one issue is about the connectivity and when it comes to slicing, so that we could have dedicated slice for different applications, knowing that applications have different requirements, and also taking into consideration that we need to have extremely high privacy when it comes to user privacy and also the data security. The other issue is about the mobility, so that we would like to have these type of services provide to our patients, particularly if they are located outside, the catchment area, like, in Oslo, so that we normally have patients coming from all over the country to us. So we would like to provide services so that we could provide remote assistance and also follow up with the health situation. And having this type of dedicated network slices, I think is going to be very useful for us. And also to see that we already have technical issues, how to resolve them. And when we know that some of the traffic is going to go through the public network, instead of we are going to use the private network that hospital is using currently now. And the second part actually is that we would like to provide these type of services. So the Oslo University Hospital has an aim of providing services to 30% of the patients. That's going to be outpatient clinic, but remotely from their home, so that we could, in the future, we could have more remote consultation, remote follow-up. At the same time, also we'll be getting data from them. It could be like sensor data, it could be video data.
Well, that's good to hear. Thank you, Ilanko. Deepa, if I could broaden the conversation out at this point, how have you been collaborating with service providers on these trials and use cases?
Nokia has had a lot of experience working on network slicing, and we have been working with customers across the world, across different geographies. And some of the common things we come to see is the key drivers has been either to improve the operational efficiency, reduce the total cost of operation, or enable more security and safety use cases around that, or the new Industry 4.0 kind of use cases. So maybe I can take you through some of the examples. So the recent one, for example, Nokia and Orange have been working together to have the first Industry 4.0 4G, 5G private network with slicing. And this is used in the Schneider factory in France, wherein we are using slice to have mobile and robo-based telepresence and augmented reality. Another example, again, a first has been Nokia's collaboration with Mobili. This is to enable the pilot the first 4G, 5G fixed wireless access-based network slicing. And this was considering a multi-vendor network with radio core and transport, and also then we have our management and assurance solutions. So here the demand was to have specialized fixed wireless access services to be given to priority consumers. Another one which comes to my mind from recent times was a pilot that we did with an Asian operator, which is also very interesting, smart factory use case. So what they wanted to do was AR, VR based remote maintenance. And what they had was a slice to make sure that the ultra high definition cameras are used for them to do remote troubleshooting. So it has been across different scenarios, whether it's fixed wireless access, private network, smart factory, and so on. So quite diverse in that point of view.
And Deepa, what would you say are the essential demands from a service management perspective to enable these real life use cases you've mentioned?
That's a good question, Guy. So I think, there's always a charm, right, coming with 5G with unparalleled throughput, latency, and so on. And little do people realize on the technical complexity which is lying behind the scenes. So one of the key aspects that any network provider is always thinking before you launch a 5G service is how can I get the service up and running, not in months and years or days, but actually in hours and minutes, right? So the time to market. The second, very important, guarantee the quality of service which is needed for that service. Hide the complexity so that there's operational simplicity. And last but not the least, how can I enable a partner-led ecosystem and a new business model, for example, B2B2X or network as a service. So there are different dimensions to tackle here. One, like I said, the complexity of the technology brings along. Second, we are talking about a virtualized world here, plus which coexists with the physical networks. So that means you need to have a solution or a management system which is able to handle this hybrid networks. Third, unparalleled scale. We are talking with 5G with billions of devices. Ilanko was talking about sensors. So these are going to be huge in number, and that means we need to have a flexibly and dynamically scalable system. And then another point, which I can now correlate with what Ilanko said, was related to availability and also having remote access and so on. So there is going to be different types of deployments. Some could be on the public cloud, that could be on the private cloud, on the edge. So the management systems need to support that. Another dimension, super critical, is multi-vendor and multi-technology. It should be intent-based support, cloud-native support. And then last and not the least by any way, is to be having an open system, which is making sure that it's able to take in the different types of service needs. So in olden days, if you could think of the traditional networks, we were talking about define and push. So you define the service already beforehand and then make it available to the user. And we have a radical change now. So what we are talking about, design and pull. The enterprises are going to define how they want their use cases, what it should expect to do, and then provide those services. So I think from an orchestration space, there's a huge change to need an intelligent model. And from an assurance space, like we discussed a few minutes back, it's very important to ensure the quality of service across these varied type of services. So I personally feel, and I think this is Paul was echoing this in the first session, that for 5G, management and automation is mandatory. It's no longer an afterthought, as was the case with earlier network technologies.
Thank you, Deepa. Ilanko, if I can go back to those three use cases you mentioned earlier, in terms of those use cases, how important is it to have the ability to have a dedicated network slice?
So if I take this pill cam as an example, so the pill cam is basically running on a tiny little battery. So normally when you take this pill, then it has to go through the gut, the digestive system, and it will take at least 10 to 12 hours to travel through this pouch. The reason is that we would like to have the camera working on an extremely low resolution imaging, and also maybe not high light intensity focused on those areas, so that we can save the battery on the camera pill. And then when we transmit this data to a cloud and using automated way of doing analysis, like using AI, and we would like to send the signal back to the camera in case we have detected some interesting polyps, for example. And then we would like to change the camera setting on the fly, so that the camera could do high resolution imaging and also having proper lighting, for example. So in this case, we would like to do an automatic way of adjusting the camera parameter on the fly while the pill is moving. And the pill is moving with some speed, and we need to have extremely low latency throughout different type of networks this is going to go through. So for example, coming from the pill inside to your recorder belt, this would be like a short-range communication system, would be a dedicated network that could be proprietary, and then it goes into this 5G network going all the way to a cloud, and the computation potentially can be done in the edge or a dedicated cloud, and then to send the signal back to the pill to control the pill. And this is quite challenging, and I think a dedicated slice with low latency and reasonably good throughput, I think will help us a lot.
So what's next for you, Ilanko? Will these trials continue, and how will this experience help you in your work moving forward?
So I could take this example on the pill cam, because in Norway we have decided to have a public screening program for colorectal cancer. And colon cancer is considered as the second largest, both for men and women in the Western world, and also in Norway. And those who are in danger potentially are around 55 and above. And we plan to provide a screening program. For example, every 5 years, these people will be examined to look into their colon and see whether we see any polyps there. And using this pill cam with automatic way of detecting polyps without involving any physician in the loop, I think it will be potentially very useful, inexpensive, and also preferred by the patients, so that they don't have to come to the hospital to be examined, but they can take the pill at home, and then we'll be transmitting the data through the 5G network to a cloud. And the cloud would be doing analysis and providing a report to the hospital or to the family doctor, so that we can follow those patients more closely later on when those patients are showing some symptoms or signs of polyps. So this would be like a program that we plan to be testing further, and the national screening program will start in 2025.
That's very exciting to hear that, Ilenko. Thanks very much. And Deepa, a final question for you. What has been your key takeaway from the 5G Vini work, and how does this affect the evolution of 5G?
I would say, Guy, that we are facing a new operational paradigm. It started now and it's emerging, right? And this is one which is centered on user experience. So no longer are the networks representative of just having data and voice traffic. They need to be able to help the world stay connected, work together and act together with the customer experience as the key focus. As we have seen from many of these use cases, I mean, these are going to transform lives. So it's important for the solutions that we need to build, which are able to take the business requirements, the use case requirements which are coming from the enterprises on one hand, and then translate that to the programmable fabric of 5G, which is going to come. So there has to be this very smart abstraction of the network and providing a very simplified view by which the enterprises can consume much of the services. So I think to summarize, I mean, I would say automation is pivotal, not just from an operational simplicity point of view, but to ensure that the new use cases of the world, which are going to help you and me, are really going to happen. Yeah.
Great. Well, that's a very good point for us to draw our discussion to a close. Deepa and Ilenko, thank you both very much for joining us, and hopefully we'll see you again for our live Q&A show. And a reminder that the live Q&A program will be broadcast on Tuesday, the 5th of October, and this is your opportunity to submit questions for our guests in this series. So any questions you have on 5G Vini, or more general questions on the use of 5G in verticals, please send them in now. There's a form right here on the website. And if you have yet to watch it, then please take a look at the first program in this series, where we heard from Paul Grunsund of Telenor and David Kennedy of Eurescom on the background to 5G Vini. For now though, thank you very much for watching, and goodbye.